Hello, everyone. Welcome back to another episode of the Unconventional Medicine podcast. I'm your host, Dr. Kate Davis. I'm a licensed chiropractor, functional medicine doctor specializing in gut issues. And today we're going to be talking about a really important topic that is so relevant for today because I know you guys have all seen, tons of things about parasite cleansing, detoxing, all that stuff. And there's just so much noise on the internet about this topic. So I really just wanted to touch on it in this episode. And I'll be diving deep on this stuff in future episodes too. But I really just want to get this specific point across early on. So today we're going to be talking about why you should never, ever detox without knowing how your organs are functioning. So if you've heard the term drainage organs, that's what we're going to be talking about today. If you've ever heard people talk about, the fact that you should not be detoxing without targeting drainage first, this is exactly what they're talking about. So we're going to be diving deep into that today. So I'm really excited to share this information with you guys. I think it's so relevant for today because there's just so much misleading information out there, quick fixes, band-aid solutions without really getting to the root cause of what is causing your gut issues or your brain fog or your hormone dysfunction or whatever issues that you're dealing with. So really important topic. Stay tuned. Listen through the whole episode. It's going to give you so much insight and so much of a better direction to go in terms of really getting to the root cause of whatever health issue you're dealing with and actually fixing it. So, first of all, if you are someone who's new to the podcast, welcome. I'm so glad that you found this. If you love the episode, do me a favor, like it. If you're on YouTube, subscribe to my channel. If you're on Apple Podcasts, I would love it if you would leave me a review. And yeah, I just really hope you guys get a lot of value out of the episode today. And let's get started. All right, so I really want to talk today about toxins, toxicity in America, how prevalent it is, why you need to detox, how to detox safely, all these little things. And so I'm just going to touch on the high points here, and then I'll have some more detailed episodes really breaking this stuff down for you in the future. But today I really want to talk about the importance of drainage organs. So for those of you who don't know, the way that toxins get out of your body, number one is through the gut. Number two, through your gallbladder. Number three, through your liver. Those are the three main organs that are going to remove toxic waste from your body and actually, prevent things from building up in your system like heavy metals or radiation when you go to get x-rays and CT scans and things like that, or all of the barrage of toxic chemicals that we're exposed to on a daily basis. So for those of you who are unaware of that, the reason why people can go to Europe and eat bread, eat cheese, feel completely fine is not the food itself. It's the fact that in America, we allow all these extra ingredients, all this extra garbage to be added to our foods. The way it's processed is completely different. The way that the animals are treated to make dairy is completely different than in Europe. And that's why people can really, go to Europe, eat whatever they want, feel completely fine. And then as soon as they come back to the States, they have a piece of sourdough bread that they think is healthy, and it just completely bloats them up and they get constipated or they get brain fog or migraines, you name it. And so there is a constant barrage of chemicals that we're exposed to in America because there's way less regulation here. It's very much, there's so much lobbying from these big corporations at the level of Congress, for people who produce pesticides, for pharmaceutical companies, for all the chemicals that are allowed and generally recognized as safe in the food industry. There's over 10,000 unregulated chemicals in America in our food supply, in our clothing, in our hair care products. Over 10,000 that have, never been studied, never been, or at least not in depth, no long-term studies, that are generally recognized as safe, that have actually, accumulating over time can actually cause significant damage and issues in your body. And so the way that toxins get out is essentially, it's not just toxins we're exposed to, it's also waste products. So all of the waste that every cell in your body produces on a daily basis, your brain, your lungs, your kidneys, your heart, it has to go somewhere. It has to get out of our body, right? So all those toxins are going to be pulled out by what's called your lymphatic system. It's essentially the sewage system in your body. It's going to pull waste from your brain, from your kidneys, your lungs, your tissues, your muscles, your joints, send it to the bloodstream. The liver is going to be the first pit stop that it's going to hit. And your liver, one of its main jobs is to pull toxins and waste products out of the bloodstream, break them down into non-toxic products, and send them to your gut via the gallbladder. So if this process does not happen properly, If you have a lot of damage to your liver from, heavy drinking in college, probably the number one place that all this stuff starts, from long-term use of, antibiotics or Advil or Tylenol or birth control, any sort of medications can cause toxic effects on the liver. It can start to downregulate that detoxability because your liver has over 500 functions in the body. And so if it's only functioning at 60%, then you're going to lose a lot of those hundreds of functions. And one of the biggest ones I see with people is their ability to actually get toxins and waste products out of their body. So that's why you see a lot of people with lymphatic system issues, with brain fog, with weight gain. It's really an inability of your body to get rid of a lot of these toxins. And obviously there's nuances to all of those issues. I'm just giving you a more general one. But really, really important that you have good liver function. Blood work will not tell you if you have good liver function. So those of you who are just like, oh, my liver enzymes are normal, that's not the full picture. You actually can still have fatty liver and have normal blood work show up. And so that's why it's not the best way to just see how your organs are functioning. Now, blood work is amazing, can really give you good insight into hormone function, kidney function, liver function, all that stuff. But there are extra things that really give you, better insight into that. So it's not just infections, it's not just toxins we're exposed to and chemicals, but it's also, the waste that your body produces every day. So if you have leaky gut, and I've done an episode on that. Definitely go check that one out. If you have leaky gut where that gut lining breaks down and now large food particles and infections and toxins can slip into your bloodstream and create systemic inflammation and extra stress on the liver, that's going to greatly influence your body's ability to get this toxic waste out of your body. And a lot of times it'll just recirculate through the body, cause massive amounts of inflammation and a lot of issues. And so we don't want that to happen. We want to have solid gut function. We want to have a really good gallbladder function. Keep your gallbladder at all costs. Unless you are deathly ill in the hospital, you should not be getting your gallbladder removed. If you have gallstones, they can come out naturally. You don't need to get surgery unless it's blocking a bile duct, unless there's, some other significant risk or issue going on. Always keep your gallbladder. It's one of the most useless surgeries in America. I will say it right now. Obviously, there are cases where you do need to get it taken out. I know a lot of people who've been hospitalized and that was the only option. And absolutely at that point, you kind of have to. But if you're someone who, doesn't really have that many issues, you maybe just have some acid reflux or some indigestion, do not let your doctor rip out your gallbladder. It has so many functions besides breaking down fats. It helps stimulate bowel movements. It communicates, with your thyroid, helps remove heavy metals from your body. And so there are just so many different functions of these organs that are just so carelessly removed, like tonsils and the appendix and the gallbladder, that we don't want to do this unless it's an absolute last resort. But also the fact that your gallbladder is one of the main organs that removes toxins. We definitely do not want to lose that organ because then you're down to, 2 organs that are trying to do all the work that 3 should be doing. And so really, really important to understand. Number one, before you want to do a detox, do you have good gut function? Do you have good gallbladder function? Do you have good liver function? Now, you might be asking, Dr. Davis, how the heck do I know if I have leaky gut or if I have gallbladder dysfunction or liver dysfunction? There's a lot of symptoms that can really tell you a lot about these organs. So some of the main ones I see with gut issues, obviously, they're going to be the most common ones, right? Bloating, constipation, acid reflux. If you're not pooping 2 to 3 times a day, unless you're on the carnivore diet, you're obviously going to be pooping less because there's way less fiber. But if you're not pooping 2 to 3 times a day, that's a sign that your body is not effectively eliminating and removing waste from your body. Now, another one is food sensitivities that you never had as a child. So if you're an adult and you're listening to this podcast and you're just like, yeah, I used to be able to eat dairy and drink milk or eat bread or tomatoes or garlic, and now all of a sudden, as an adult, my body can't handle those foods anymore. That is a huge, huge red flag that your gut lining has broken down. You've got some leaky gut going on, because the only way that happens is when that gut lining breaks down, food slips into your bloodstream, triggers an immune response. Now, every time you eat that food, it triggers that immune response in your body. And so if you're someone who has any of those issues, you need to get your gut checked out. You got some gut issues going on. I actually have seen a lot of people too who have normal, healthy bowel movements. They don't have any bloating or GI symptoms. They've got some other stuff going on and they still have leaky gut pop up. Now, obviously there's different degrees of it. High amounts of stress is a huge, huge trigger for leaky gut. So I see a lot of people who had a really stressful life event and then all of a sudden all these gut issues popped up. So those are major things to look out for with gut issues. If you outside of testing, obviously. And then with gallbladder function, constipation. Your gallbladder, one of its main functions is to stimulate bowel movements in the gut to remove this waste product from your body. So if you're dealing with constipation, you probably have gallbladder issues. That's probably one of the number one things I see. If you have acid reflux, you probably have gallbladder issues because your gallbladder tells your stomach to produce enough acid to digest your food. And most acid reflux cases are actually low stomach acid, not high, which is why you get temporary results from antacids, but eventually the acid reflux comes back because it actually makes the problem worse. Some people end up with gastroparesis. That was my story. I went on antacids for 4 months, ended up with gastroparesis, which basically meant my body could not move food from my stomach into my small intestines because I basically had no stomach acid. And it was extremely painful and terrible, but luckily I was able to find someone who helped me and got me out of that horrible situation. So if any of y'all are listening with gastroparesis, I feel your pain. There is a way out of it. You don't have to go on crazy drugs or get your intestines removed. There's absolutely ways to heal it naturally. Those are the things I want to start with. Is number one, do I have gut issues? Do I have gallbladder? Liver dysfunction. Some of the biggest things I see are hormone issues. So if you have horrible periods, if you have hormonal acne as an adult that you never had as a kid or a teenager, that's a huge sign that your liver's under a lot of stress. Your hormones are recycled in the liver. So if you have a lot of hormonal issues, I'm usually thinking liver dysfunction. Skin issues are almost always liver related because you just have high toxicity in the body. One of the major organs that's going to take over that detox function if your liver isn't functioning well is your skin. Also, your kidneys, if you're someone who gets up to pee constantly in the middle of the night and you don't even drink that much water before going to bed, that's a sign that your kidneys are doing the liver's job, which is not good. We don't want that to happen. That can lead to severe kidney issues and kidney stones and kidney failure in some cases, which I have seen in people I've worked with who had a history of kidney failure at a young age. And we did testing, found out they had horrible gut function, horrible liver dysfunction. Once we fixed that, all of their symptoms went away. Kidneys were looking good on blood work, didn't have any of those issues anymore. And I've seen kidney stones disappear just from supporting liver and gut function and removing these stressors in the body. But you guys, you've got to do it in a really safe way so that you don't mess yourself up. So those are the 3 organs. Those are the symptoms to look out for. If you have any of those problems I just mentioned, you probably have issues with drainage and your body's ability to get toxins out of your body. Another big one that people don't think about is an inability to lose weight. So your body is really smart. It's always going to protect survival functions. If you have high toxicity, a lot of toxins floating around in your bloodstream, it's going to want to sequester them and to get them away from your organs because your body's number one job is to keep you alive. And so it doesn't want those toxins going to your brain, your lungs, your heart, your kidneys, and causing massive damage. So what it's going to do is it's going to take those toxins, pull them into fat cells, and store them there. So I've seen a lot of people who are very active, eat very well, and they just cannot lose weight. Now, obviously, there's a lot of nuances to weight loss. I'm not saying this is the only thing. Hormones are a big one. Stress is a big one. But one of the biggest things I've seen is once we reduce the toxicity in the body, now all of a sudden they lose weight so easily. It happened to me. It's happened to dozens of my patients who, the best one was someone who had lost over almost 50 pounds in the 4 months she was detoxing and was able to keep the weight off. And she's still doing well. And that was probably 5 years ago. And so I've seen this time and time again where people are just like, yeah, I've tried everything. My hormones are normal. I just can't lose weight. And then we do testing and we find very high toxicity, lots of infections in the body, difficulty with drainage organs. And once we start healing those organs and getting those toxins and infections out of the body, now all of a sudden they lose weight so effortlessly and they're able to keep it off. And so that's another big thing to keep in mind. Also, if you have high fasting insulin and you're super, good with diet and with exercise, one of the biggest things I've seen, because I've seen a lot of people's insulin get pretty much cut in half and go down to normal functional levels, is high toxicity. If you have inflammation at that cellular level, your body's not going to be able to get sugar into the cell, even if you're doing everything right. And so these are all little things that I've seen in people that's just so cool just to see them, get their metabolism back on track, get their gut health back on track, start feeling good again. Their sleep is better, their energy is better. And it's really just by starting with the basics. Where is there a breakdown in drainage? Why can't your body get toxins and waste products out? Because you could be on all the lowest tox products, which I've heard from so many people I've worked with, and you still have high toxicity in your body because your cells produce waste every second of every day. So even though you're removing all those toxins from that overflowing bucket of toxic waste in your body, you're not adding anything to it, but you're also don't have the ability to get that stuff out. And all the waste that your cells are producing every second of every day is just slowly adding to that toxic load until eventually something breaks. And all of a sudden, I had constipation. All of a sudden, hormonal acne. All of a sudden, weight gain that came out of nowhere. And I've heard that from so many people. And you guys, this stuff builds for decades. It doesn't happen overnight. That's why lifestyle choices are so incredibly important every single day, to do something to downregulate your nervous system, keep stress low. Number one thing you could do for immune system function and hormone function. You got to do things every day, make good choices with your food, good choices with the products you put on your body. And most of us have decades of using garbage products because we didn't know this stuff. Like when I was a kid, everyone had body sprays, those hot pink ones that smelled great, but they are toxic to you. And so that's another huge toxin exposure, is what are you putting on your skin every day? For women, there was a study that came out, I believe it was at least 5 or 10 years ago, that talked about how the average number of chemicals, so man-made synthetic chemicals, that a woman puts on her skin and her body every single day was over 160. And so you imagine that compounded over decades. Of course, your liver's struggling and you're having hormonal issues like PCOS and horrible periods and menstrual cramps and hormonal acne and all those things that go with it. Of course, you're having constipation issues. I mean, this stuff really does wreak havoc on your body, create tons of inflammation. So we've got to start there. Our personal care products, we've got to clean that stuff up, you guys, especially if you're a woman. We're putting, makeup on and lotion and hair products, and, men don't use as much of this stuff. They might have just cologne. But we are just so sensitive to this because of the amount that we put on our body. And I guarantee if you just go look at your shampoo in your shower, you're going to see at least 40 ingredients on there. And I bet you don't know what at least half of them are. And so I would challenge you to, start replacing one item at a time. You don't have to change your whole life overnight. So don't be that person who thinks you're going to just overhaul everything. It's not going to be sustainable if you do it that way. And there's a lot of habit change research around that, which I'll talk about in another episode. But really important, guys, you've got to clean up the stuff you're putting on your skin. Your skin absorbs everything you put on it. And so we want to make sure it's really good quality stuff, really good quality products that we're putting on and in our body with food. So, that's basically drainage. Got to make sure, number one, are those organs functioning? If they're not, absolutely do not do a detox. You will probably feel worse after, or you won't notice any changes. I've heard so many people who do a parasite cleanse and they're like, I didn't notice anything. And I asked them, did you do any testing to see if you actually had parasites? And they're just like, no, I just thought everyone had them and it was good for me. And then I do testing on them and maybe they just have mold toxicity or fungal overgrowth and it had nothing to do with parasites. They were just targeting the wrong thing. And on the other end of that spectrum, I've seen people who have told me they've ended up in the ER because they detoxed incorrectly. They didn't understand that drainage had to be open first, that they had to be pooping 2 or 3 times a day before they just started killing off parasites and trying to remove mold and systemic heavy metals from their body. And so they ended up really, really sick and in the ER. And so we don't want to be on either spectrum of that. You want to get results quickly and efficiently, save time, save money, always get testing done. That's the best way you're going to see which organs are not functioning well and be able to see what's actually causing that damage. So drainage, super, super, super incredibly important. After you open up gut, gallbladder, and liver and make sure they're draining properly, you're going to want to go after lymphatic drainage. So that's another thing where I see people who, they do lymphatic drainage every single day, but they don't really understand that if you're just dumping a bunch of lymph fluid into a backed up system, I always kind of describe it as a clogged toilet. If you go into a public restroom and you see that a toilet is clogged, are you going to be like, you know what? I think I'm just going to chance it and see what happens. No, you go to the next stall and use the other one. But this is what people do to their bodies all the time. They're just like, well, I'm constipated. Let me start with lymphatic drainage. But if you just start doing a bunch of lymphatic drainage and there's nowhere for those fluids to drain, it's just going to be recirculating all these toxins back into your body. So there is an important way to heal. And it's really important, you guys. I know it's easy. I know it's cheaper to just buy a supplement you see on Instagram or Facebook, or you heard from Sally's aunt's cousin's brother, this healed his gut issues. But you always want to work with someone who can really guide you through that process safely and make sure that you're not going to mess yourself up and that you're actually targeting the right things. I know that parasite cleanses are super popular. I talk about them all the time on my Instagram channel because that was my massive infection that I had that led me to being able to heal all my gut issues, but not everyone has those issues. Sometimes you have co-infections like mold toxicity or fungal overgrowth in the gut. I had both of those. So I had to clear out all the infections, not just the parasites. But parasites, they're a trending topic because you see them come out. So you're just like, oh, this is why I felt terrible. This makes perfect sense because look at this big old worm that just came out of my stool. And that's what happened to me. And so I just started talking about it the most. But you guys, just because it saved my life and helped fix all my problems does not mean it's going to help you. Everyone is an individual. Everyone's unique. You've got to figure out, first of all, what is damaging the gut, what's damaging your gallbladder, what's damaging your liver. Do you have heavy metals or a lot of environmental toxins in your body? Do you have mold toxicity or fungal overgrowth or a chronic viral infection like EBV that's constantly tanking your immune system and preventing it from being able to do its job? And so these are things that you really have to look at. So always work with someone, always get testing done, know what you're targeting. Otherwise, you're just throwing a dart blindfolded in a room and hoping that it hits the target, which it rarely ever does. And I know there's some people online who are just like, yeah, I tried this spray or this 1 week cleanse and it fixed all my issues and great for them. They just hit the jackpot early on, but most people do not have that experience. And so I really just want to, stress this topic because it's such a trending thing nowadays that I see so much and I see so many people do it wrong. And I just want you guys to find results faster without wasting a bunch of money and time on all these quick fixes. Because in America, we have this mentality of one problem, one solution, or one pill, or one quick fix or quick thing. You guys, it's literally a lifelong change in lifestyle, change in things that you're putting on and in your body. It's really getting to the root cause of what specifically is causing your issue. Because if you line up 10 people I've worked with who had constipation, they all had completely different care plans. Some of them had mold toxicity. Some of them had heavy metals. Some of them just had really terrible leaky gut. And we just had to really heal the gut up for 3 to 4 months. And then they were totally fine. And, it really just depends on the person. And some people really needed to balance out their blood sugar. So we worked on, hey, here's some daily lifestyle things you can do to help get your blood sugar under control so that we can combat all these other issues that you're having. And so it really just depends on the person. So anyways, that's my soapbox. Talk about it so much. And I'll definitely keep talking about it again in future episodes because I think it's such an important point to get, is that in actually healing the body, in real medicine, if you want to truly heal your body, you have to be specific and it's going to take time for most people. Now, I have seen people heal incredibly quickly, faster than I thought was possible, and that was amazing. But for most people, 4 to 5 to 6 months, and then we still have maybe a little bit to work on the back end, And so it's really, we've got to get out of this mindset of, I'm going to do a quick detox just to get my health back on track. It's like, okay, well, are you sleeping at a normal time? Are you going outside every day? Are you doing things that are going to help regulate your nervous system, like journaling and breathing and grounding and, being around friends and being in community and, all these things that people just don't think about because all of that affects your whole entire physiology. So we've really got to look at every aspect of health, not just one. All right. So I know I already talked about how drainage organs will cause other organs to kind of take over that drainage function. So obviously skin, kidneys, you can get kidney stones, lots of peeing in the middle of the night, skin issues, all sorts of various skin issues with drainage problems, lungs. So if you're someone who gets sick multiple times a year or every single year, if you're around your friends, kids who are wiping their snot on you and you get sick every single time, that's a huge sign that your body's probably not detoxing well. You probably don't have good immune system function. If you're getting sick multiple times a year, it's not normal, guys. And so that's one of the organs that will take over when those major drainage pathways are not functioning. And then another one, because I get people who ask me this all the time, Dr. Davis, if most of my issues are in my gut and in my liver and I have infections, why do I have brain fog? Now, besides the gut-brain connection, which is huge, those of y'all don't know, your gut is like your second brain. Some would argue the first brain. But if you don't have good gut function, think about it in terms of drainage. If you have that clogged toilet and you don't have good gut function, you're not pooping 2-3 times a day, your gallbladder's not, functioning well, your liver's not clearing toxins from your bloodstream efficiently, your lymphatic system's backed up, you can't drain toxins out. So what happens is they just sit around your brain, and your brain is just sitting in its own waste products because there's nowhere for those waste products to go because your drainage is so backed up. And so that is why you'll see a lot of these peripheral issues like lymphatic issues where people, their hands swell up, their feet swell up, their face is swollen when they wake up in the morning. And it's because their lymphatic system can't drain because there's a blockage in all these drainage organs in their body. And so I've seen so many people have crazy things happen, like their gums stop receding, or their cavities in their mouth go away, or their vision gets better to where they don't need reading glasses anymore. Their brain fog goes away, their headaches, their migraines. And it's because of this downstream effect. You guys, we've got to stop separating every organ system in the body and just treating that organ. They all function together. There are so many interconnections in the body that you cannot just treat the brain for migraines. It could be something that's coming from the gut or drainage or mold toxicity or heavy metals, and that's what's actually driving those migraines in people. It could be structural. Maybe they need to see a chiropractor or someone who does myofascial release or craniosacral therapy. It really just depends on the person, but every single system affects every other system in the body. It is so incredibly complex that it's just silly that we've broken up medicine into neurologists for brain issues, cardiologists for heart issues, GI docs for gut issues, when most of those symptoms function together. And so I've seen people's blood pressure go back to normal just from detoxing, because again, you're taking that stress off the kidneys. That's where blood pressure is primarily regulated, is in the kidneys. Or if they have a history of head injuries, that can also trigger that as well because of that, the connection between your brain controlling internal organs, all that stuff. But everything functions together. And that's why it's so important to get a full picture. Even if you have gut issues, I'm still going to want to see fasting insulin. I'm still going to want to see overall inflammation in the body with a, CRP test. I'm still going to want to see cholesterol because that tells me a lot about liver function. I'm still going to want to see, nutrient levels in your body to make sure that you're absorbing things properly. Certain nutrient deficiencies can tell me a lot about liver, gallbladder, and gut function as well. So we've got to look at the whole picture. We've got to stop breaking up, these issues into one organ, one solution, one problem. They're all interconnected, you guys. When you really get to the root cause, when you really do full testing to figure out what the heck is going on in your body, you can have dramatic results. And I've seen that with hundreds of people whose lives are dramatically transformed. They can eat bread again. They can eat dairy. Their migraines are gone. Their headaches are gone. Their anxiety and depression are gone. There's a huge mental health component with the gut. And I've just seen this so much, you guys. And so it's just so important to never detox without fixing these drainage organs. I'm just going to reiterate that in case you zoned out in the middle of the episode. But so incredibly important, you guys. Don't ever detox without supporting drainage first. If you just leave this episode with one thing, let it be that. All right. And then lastly, I want to say, which I've already kind of touched on a little bit, is get some testing done. You guys, it's worth it. Just pay the money, get some testing. No, your medical doctor will not order functional tests. They're not covered by insurance. I know it's frustrating. I'm hoping that changes in the next 5 to 10 years because it seems like the medical system is shifting in a good way, which is amazing. So I'm really hoping that, things like the gut zoomer test, the urine mycotoxin test, and environmental toxins testing will actually be covered by insurance. But unfortunately, it's not right now. But if you really want to get a full understanding of what's going on in your body, you've got to pay for testing. You've got to get more than the standard yearly blood work because there's so many markers that are not on yearly blood work that should be, because they really tell you about your overall health, like fasting insulin and GGT and CRP. And I'm gonna have a whole other episode on that because it's so incredibly important. And we really want to see these and full thyroid panels, not just TSH, because that tells you literally nothing about how your thyroid's functioning. So really important that you get testing done, get a full picture of what's going on, work with someone who can help walk you through the process. And if you're someone who's listening to this and you're like, oh, I don't even know where to start, I do work with people remotely all over the country, except New York. Sorry if you live in New York. I do not work with people in New York because they make it pretty much impossible to order any testing. They blocked most of the labs from coming in. But if you live anywhere else in the country, even out of the country like Canada, Australia, I have a link down below in the show notes. If you click that link, I will give you $100 off an initial consult plus labs testing. So basically you'll get the initial consult for free. We'll jump on a call for an hour and go through your whole health history. I'm really get an idea of, what organs aren't functioning, what could be causing them, like infections and toxins. Are your hormones out of balance? Do you have maybe some metabolic issues with blood sugar and fasting insulin? And really get a full picture. And then we'll order some, if you don't already have blood work done, we'll order some blood work, get some testing done for infections, toxins, and organ function and nutrients, and really get a good idea of what's going on in your body. And then I'll put you on an individualized care plan, detoxing properly, really going in order of those drainage pathways of healing the gut first, then the gallbladder and liver, then systemic toxins and infections. But we've got to open up that drainage first. So if you're someone who wants to work with someone, get your health back on track faster and do it without ending up in the ER or without seeing any results, definitely click that link in the show notes. And if you enjoyed this episode, please do me a favor, leave a 5-star review on whatever platform you're on. Subscribe to me on YouTube if you're watching the video format, and I will see you on the next episode.